exciting for me watching their results as they grow because every result is different. And it's fun when they, I get all of a sudden I'll get a text message with a picture. Hey, look at my result. Look at it. Look at my progress.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Tanya Harrison of Aesthetic Wellness RN. Tanya has been a registered nurse for 29 years, specializing in clinical case management, specialty IV infusion, PACU, and internal medicine. She utilized her vast experience to evolve into the world of medical aesthetics, which has given her the opportunity to inspire beauty, confidence, and self-empowerment on a daily basis. This stems from her desire to help clients achieve their aesthetic wellness goals from the inside out. She specializes in derma PRP, weight loss, PLLA, collagen BBL, IV hydration, skin resurfacing, dermal filler, body contouring, and more. So Tanya, welcome and glad to have you here on the show.
Thank you, Daniel. It's an absolute pleasure to be here.
Yeah, so let's dive right into it. How did you first get interested in aesthetics?
So really, it kind of started as my kind of retirement plan, if you will, from bedside nursing. And I had an interesting segue into the industry that really was inspired by both of my daughters. So my youngest daughter kind of got into traditional wood sculpting, body sculpting, and I found that to be kind of intriguing. And while she was doing that, my oldest daughter had also gotten into aesthetic school. And it was just something she had intended to do as something fun on the side from, working in the financial sector. So she wanted to do something creative, right? And then COVID hit and all that changed and she wound up going in full time. I think COVID did that to a lot of people, right? Mm-hmm. And so out of all of that, I then decided I had been kind of contemplating going ahead and taking courses to get trained in aesthetic injectables. Mm-hmm. And once the girls had done that, I just decided to go ahead and press the button. And so I hopped in, took the courses, and then I didn't have a real plan of how I was going to execute it, if I was going to go and work for a practice, if I was going out on my own. So I didn't have a clear picture initially. And so it took probably about near a year before I decided fully how I was going to execute my plan. Mm-hmm. And we knew as that time evolved, we knew that we wanted to work together, right? So my daughter, the esthetician, and myself, but then it was a matter, okay, where are we going to set up? She was already currently in the building that we are in now, but there was another med spa here. So there was no way we were going to be able to be here, right? Obviously. And then one day she came in and they were mysteriously gone. So the universe kind of moved some things around and voila, here we are. So we were able to come together and work as a mother-daughter team, and the rest is practically history. So now we're looking at almost 3 years together.
Wow, that's an incredible story. I guess the universe was just aligned in that sense. They wanted it to happen.
Absolutely.
So how's been that transition from you of working as a bedside nurse to now starting your own business, running your own practice? Like, how's that transition been?
Right. So the last 20 years or so, I had kind of transitioned a bit out of like hospital care, and I moved into more clinical case management where I do a specialty. I'm a specialty infusion nurse. That gave me a lot of autonomy because I handle my cases and I manage my clients. And so everything, I was fully in charge of everything. So that was kind of already setting me up for what it takes to be an entrepreneur, because I'm literally managing everything practically on my own as it stood in that particular role. And so I knew, just because of that, I knew that IV hydration would obviously be a part of my practice, because I could do it literally with my eyes closed because of all the experience, 20 years of experience in specialty infusion, which is a very specialized field. So I knew that that would be a part of my practice. And teaching is a huge part of clinical case management. And that piece of the puzzle is a huge part of our practice now. And I feel like it is so necessary because all of my clients, really, a lot of clients, especially when they're dealing with certain issues, there's a lot of gaps in knowledge. So we take it upon ourselves to make sure that we are educating our clients a lot, which also helps them have better prolonged results. And it protects their investment when they're coming here spending their money, right? So it's really been a bit of a smooth transition because I really was kind of setting myself up, it's, as it turns out, all along.
Got it. Now, I want to talk a little bit more about the common treatments that you offer. You mentioned IV infusion, and then in your introduction, there was a bunch of other treatments as well. So would you mind diving a little bit deeper? Let's start off with the IV infusion. For people who don't know what IV infusion is, what is it, and really what are the benefits of it?
Right. So IV infusion, you might hear the keywords IV infusion, IV hydration, IV therapy. Essentially, what that is a way for us to get hydration and key nutrients such as vitamins, minerals, and some amino acids, possibly directly into the bloodstream. The benefit of that is that we are able to completely bypass the gastric system, your digestive system. And by doing so, your absorption rate of these key nutrients goes up exponentially. So the benefits of getting those nutrients in, you can experience more readily, so almost instantly, and more prolonged and more profound effect, right? So what we're finding most beneficial, especially when we're talking about here in the US, unfortunately, the American diet is a bit cringy. And a lot of people are really suffering from poor gut health. So, and that's just related to the ultra processed diet that many people are consuming. So when you have poor gut health, obviously your absorption of key nutrients is not going to be good at all. So even if you are taking a multivitamin or you're taking other things orally, your absorption rate is going to be pretty minuscule. And I don't know if you've ever paid attention or questioned, like when you purchase vitamins, you may notice that the daily value is like several 100%. Like it may, right? And you're like, okay, why is it 500% of the daily value? Well, that's because when you ingest it, your digestive enzymes get in there and they pretty much destroy the majority of the vitamin, right? And then if you couple that with poor digestive health and other things and lack of like it's just your absorption rate is really not that good. So IV hydration really is a way to circumvent all of that and get you directly into the wellness. And it also will help give you the boost that you need now to make better decisions and get you on a better track to overall wellness.
I think I'm glad that you explained that, because even for myself, I didn't even realize that. Like when I'm looking at these vitamins, I'm like, okay, like 500%, like what do I need? 500%.
Right.
I guess I'm just trying to be more safe than sorry. But it makes so much sense where it's like, if you get, for example, like 10 milligrams, you ingest 10 milligrams, but maybe only 1 milligram gets into your system. Or would you rather have 2 milligrams, but you get the full effect of that 2 milligrams? It makes
Exactly. A lot more sense, right?
Okay, got it. So, so we talked about IV infusions. What are maybe some other common treatments that your clients come to you for?
Right. So right now, weight loss is huge, right? And that is huge really for all the reasons that I just discussed, right? The American diet is not good. You're seeing a lot of people that are really suffering. I mean, you can look pretty much, and as we know, I'm based here in Texas. Everything is big in Texas, including the portion sizes and everything else, right? So there's a cost, right? There's a cost for that. And so a lot of people are overweight and they're experiencing the side effects of being overweight, right? So we're getting a lot of clients coming in for weight loss. And of course, they're male and female. They're coming in anywhere from their mid-20s up into their 70s to seek these weight loss treatments. I took some time before I actually launched my weight loss program. You know, the GLP-1 semaglutide, that whole craze. It's been around for a few years now, and for good reason. And that is because the drugs work. They work. You are going to lose the weight, right? The problem is that the medication does not differentiate on where that weight loss is going to come from. So you may lose, your fat and your body composition is made up of different things, right? So we have two kinds of fat. We've got our subcutaneous fat. We've got our visceral fat. So those are the two kinds of fat. We also have skeletal muscle, and we also have hydration, right? So all of these components are making up your overall weight. When you go on these medications, it's just going to pull weight from skeletal muscle. It'll pull it from subcutaneous fat as well as visceral fat. We do not want to lose skeletal muscle, okay? Especially as we are aging, okay? We need to have strong skeletal muscle. We need to maintain things like our core strength, flexibility, things of that nature are very important, especially as we are aging. And it also, you can tell those people who haven't gotten good coaching on their weight loss journey because they lose all the weight or they get to their goal weight, but they don't look well. And I have actually had clients come in from either other practitioners or they were on the self-dosing regimen because, you can order those drugs online and have them sent to your home and you can self-inject. I see a lot of issues with that, and I have clients that come in from those from having those using that particular model, and they've had a lot of side effects. They've lost a lot of skeletal muscle. So it took me some time to really kind of figure out what my approach would be to help my clients mitigate those pitfalls. Okay, so my clients, my wellness babes, and my wellness gents, as I so love to call them, they actually improve their skeletal muscle, they improve their hydration, they improve their protein intake, all while decreasing their subcutaneous fat and their visceral fat. And by doing it in the manner that we're doing it, they're seeing improvements also in their metabolic age. So your metabolic age, oftentimes my clients, when they first come in, most people are running anywhere from 5 to 7 years older on their metabolic age. So that is a direct indicator that the lifestyle that they have been living is having a negative impact on their internal organs. We're actually able to start getting that metabolic age to come more aligned with their actual chronological age with our approach.
Nice. Now, Tanya, are there any new or emerging treatments within here that you're really particularly excited about?
Yes. So we have just launched our Selenius Dermagel PRP. And, PRP has been around. It's not new. But the Selenius Dermagel PRP is one of the newer approaches to PRP. And I love this particular system. And the reason that we went with this system is because the way that we are able to get a very clean sample of actual platelets because of the technology of the dermagel, it actually gives our clients a more exponential result. Right. So your sample, your results are only going to be as good as the sample that you're able to get. So you will see, sometimes you'll see results with PRP. I've had people come in and say, I've done PRP before. I didn't really get any results. Or I wound up, they get this horrible, it's like a horrible like bruise that can show up in the areas that are treated. And that is usually can be related to the fact that the red blood cells were not fully separated from the platelets during the process. So, and it can lead to, and that is very difficult to treat. And it's a whole situation if that happens. With our Selenius Dermagel PRP, we are able to circumvent all of that and actually get our clients really, really great results. The benefits of PRP is that first of all, it's 100% natural. It's completely your body. So we're not using any synthetic fillers or anything of that nature. It's literally going to be 100% your body. And when we inject it, it is the platelets are going to generate actual collagen and elastin growth. And it can also improve lymphatic drainage in the areas that we're injecting. It can also help to rebuild some of the fat that may have been lost in the area. So all of those components overall just give you a more youthful looking appearance and will grow and evolve with you as you are aging. So we're actually correcting the issue and not masking the issue.
Got it. Now, Tanya, I want to talk a little bit more about your practice and really what differentiates your practice from others in the industry. I think your experience in the industry is one very big differentiator, but what are some other things that really differentiate you from others?
From others, I really feel like, it's in the name. So aesthetic wellness, emphasis on wellness. And so the approach that I take here, it stems from there. So everything that we do here stems from a place of wellness first. And what we do is we implement services, we try to implement products and treatment plans that allow our bodies to do what they were made to do, which is heal itself. Okay, our bodies are amazing. We can do anything as long as we have the tools to do so. So we love to implement plans, treatment plans and services that literally allow the body to pretty much heal itself. So we will, I know for a fact, I have not seen anyone else in my area. One thing that we love to do when my clients come in, let's say just for like a skin issues, right? So what we're seeing, we specialize a lot in age management. One of the things that we're seeing is a lot of postmenopausal women are experiencing acne. They're like, what in the world is happening with my body? As a teenager and a young adult, I did not have acne. And now I'm over here looking like I'm in puberty. Like, what is happening to me, right? And so your skin is obviously your largest organ, right? So when your skin is telling the story. It's telling the story of what is happening to you internally. So our practice helps our clients recognize the connection of your internal health with how you are showing up in the world. And so everything that we're going to implement here we're also going to give you information and tools. We're going to look at what you're doing in your home plan, and we're going to bring those things together so that we can help your body heal itself. And one of the services that we do is we do facials with IV hydration, because the connection of IV hydration and those key nutrients that I talked about is very important. So oftentimes when you come in and you've got like dark circles around the eyes, that's a key indicator that you're likely low in B12. If you are having a lot of textural issues in the cheeks and things like that, and hyperpigmentation, we love to go in and use the powerful antioxidant glutathione, which does wonders for inflammation, texture, as well as gut health. Is great overall too for the body, for muscle recovery, and to remove toxins. So when your skin is exploding with all of this acne and all of that, you pretty much got some toxin overload. You've got your pores are overloaded. So we're going to help you detox all of that internally, as well as the gut health. I mean, the glutathione also helps with your gut health. So all of those things are working together to help your skin look better, right? So that is one of the huge differences that we use here to take that different approach. And our skincare is completely different. We don't use any facial devices like some of the larger brand names, but our results just with using pharmaceutical products and combining it with nutrition, we're able to get our clients amazing results.
You can bring up some really good points in here. And you also mentioned before about the education part of it, like educating your patients, your clients on the benefits. And I think also like you brought the point, like the dark circles around the eyes. Like I didn't know that. I think a lot of people don't know that. They come in and they just have no idea what's wrong. So, and I'm sure you've got a lot of people coming in where they have these common misconceptions about they may think it's one thing, but that's not the case, or they have no idea. So could you share some maybe common misconceptions that you hear from your patients when they come in and see you?
Yes. So one of the things, a huge common misconception when we're talking about fine lines and wrinkles, first of all, people confuse Botox and filler, where these things need to go. And so they may come in and request Botox when actually they need filler or they need hydration or they need nutrients, right? So and we help them understand that. So our goal here is, of course, all of the medical injectables and aesthetic tools that we have, especially injectables in particular. So let's narrow it down. In particular, when we're talking about toxins and we're talking about dermal fillers, those are wonderful tools. They're the most used. They're kind of like as they say, the gateway into aesthetics, right? So usually the first thing people will get is like some lip filler, or they'll come in and get some Botox or something, right? And then you kind of are able to expand their horizons into all the other options that are available to them. And so what we like to do, and I tell my clients, all of these tools are wonderful, but our goal is to provide these tools, but also get you the understanding of what you need to be doing at home that will also support and potentiate the results of the tools that we're using, right? So when you come in here this first time, you may need the maximum dose of Botox. The goal is to, over time, get that to go down because we're actually addressing the core cause of the lines and the wrinkles, right? And our clients appreciate us for that.
Yeah, I think you bring up a really good point as far as you mentioned it's in your name, wellness. And I think a lot of people don't think about aesthetics as wellness or fixing the core issue.
Right.
But I think that's important because everything's tied in together. And especially the way that your approach, I think, is a fantastic way of doing it. Fix the inside, then that will eventually help on the outside.
Exactly.
Yeah. Now, Tanya, for this next question, I think you'd appreciate this coming from a long experience of working as a bedside nurse. What role do you believe creativity plays in how you approach your particular patient care?
Oh, wow. Yes. So, yes, creativity is everything, right? So, first of all, there's no one size fits all. Everyone is unique. And really, I mean, when we are injecting, the skill has to be there. So you obviously have to understand the basics and have knowledge of, anatomical sites and things of that nature and technique. But once you get that, then the rest is artistry. So, as consumers, the clients, when, I tell them, when I do my lives or whatever, I try to give information just to really kind of educate consumers when they're out shopping around. When you are making a decision on where to go for your aesthetic services, you're not just selecting the service or the toxin. The product is only going to be as good as the person behind the needle. Right? Period. I don't care what you're using, right? If the person behind the needle does not have that vision and the creativity, you're not going to, because the body, it's a canvas. And so each canvas is different, and you're going to need to be able to tie all those skills together. And the creativity is a huge part of that. And I really see that really come to light. I'm known for my collagen BBL, or I like to call it the wellness BBL. And it is a great experience. That is a lot of artistry. That's a lot of creativity because I'm literally building and creating a butt. And everyone is different. And it's so exciting for me watching their results as they grow because every result is different. And it's fun when I get all of a sudden I'll get a text message with a picture hey, look at my result. Look at it. Look at my progress, and I'm just as excited as they are because it's different for everyone. And as it should be, right? Because we all have our own unique beauty. And what I'm doing here is simply helping you to just enhance who you are. But we don't want you to look done. We just want you to look amazing. And people will just notice that you look amazing, but they won't be able to pinpoint exactly what happened.
Hmm.
That's when you know you've done well.
Yeah.
And then you, as the consumer, you can make up whatever story you want to make up.
Yeah. Yeah. Well, I mean, as long as people get the results and it looks natural, then I think that's a lot more what people are looking for. That seems to be the trend, is that more natural look.
I'm so happy to see that. And when I opened my doors, though, nearly 3 years ago, that was the platform I was standing on. So, period. Like, that was it. And the services that I was offering all fit into that. So, and natural looking goes with wellness, right? So, nothing that we were ever going to do here was going to be outside of those bounds.
Got it. Now, Tanya, throughout your experience, I'm sure that you've run across some kind of tougher cases that have come into your door. Is there one story that really stands out in your mind of someone that came in, they really had this big issue, and really how you were able to get them a successful outcome in the end?
Right. So the biggest, I want to say, it really depends. So we'll start again with the skin. Face. I mean, you can't hide your face, right? Everywhere you are, there it is. It's the first thing that everyone sees. And when you have major issues like cystic acne, that's a big one because of the scarring that can occur. It really can have a profound impact on your just your confidence and how you're showing up in the world. We have had many clients, but there are two clients that stand out in particular. One of them, an actor, he does some acting, lives out of state, and he actually traveled in for his sessions with us to get his skin under control. And so we did him over a period of about 5 weeks. So he was flying in weekly to get his treatments. And now it's been a little over a year since we completed his treatment plan. And you could literally see, there's him, like the skin, changing the skin. And with the approach that we take, we are seeing people literally have a 180 in how they're showing up. You can literally see the changes in their demeanor, in how they dress when they come in now, their personality, like they really start to blossom. They're trying new things. You really start to see the veil lifted. And that is just the most gratifying thing to see, because and that is the whole point and purpose of everything that we're doing, to really affect change in how people are showing up in the world. So, but that again comes from making sure that we are treating everyone as an individual. We're listening to them. We're getting a clear understanding of their lifestyle. And then we are putting together the treatment plan that we're going to do here that also involves addressing what's happening internally, and then looking at their home, making adjustments there, but it has to be adjustments that are going to be realistic, that aren't going to feel overbearing or overwhelming, because it's something that has to become their lifestyle, and it can't feel overwhelming because they won't keep it up, right? So that is the approach that we take. That's where we see these just profound changes in people's lives. And I just cannot get enough of how how much it's affecting them in such a positive manner. So, and we see that especially for the skin. And also, I know everyone, we talk about, the BBL. And I think oftentimes people, there can be a lot of jokes, and people think that service is kind of like it's trivial. But there is, when I have consultations, there is a lot of pain and trauma that people experience with regard to their body image, because they don't feel, perhaps they don't feel feminine enough. It takes them forever to find clothes. They don't like to shop because they can't find anything to fit, or they have even been victims of body shaming, like people literally, adults literally making horrible comments, right, about their body, and just how much of a impact that is having on them on a daily basis. And so when I'm able to give them an option that, first of all, is discreet. So when we do the injections, their collagen grows in over time, so it's not obvious. So they're not becoming a spectacle, because that's also something a lot of women have wanted to do a BBL, but they don't want to be a part of the spectacle. They don't want people to know that they've had the procedure done. And by taking the route that we provide, they're able to grow their collagen over time. So it's gradual, and no one can really pinpoint again what happened. They just notice that, wow, you look great. And then the client is able to control the narrative, right? No one is saying, oh, you got a BBL. They can literally say, oh, I've been on my wellness journey. I've been in the gym, whatever story they want to make up that they are comfortable with, they're able to do that. So yeah, those are the big ones.
I think those are amazing stories as well. And I think kind of what underpins that is that people just want to feel like their best self. They don't necessarily want to look like these crazy models or like the filtered images on Instagram. They just want to feel like their best self. And I think that a lot of people don't realize that about the aesthetic industry. Very often it's just, I want to feel like my best self.
That's exactly. And there have been so many, as I stated, there have been so many people that have not participated because they didn't feel like there were options that would allow them just to get that result. I don't want this over the top character. I don't want anything too outlandish. I just want to feel good and look good as myself, right? So that's the gap that we're standing in.
Now, Tanya, where do you think the future of aesthetics is going?
Oh, the future of aesthetics is going definitely, as we talked about, into the more natural looking PRP, platelets. Those services are going to be anything that's biostim, that stimulates your body to do its, like I said, heal itself. That's the future. That's where it's going. I'm happy for that because that's where I was always standing. And so now I will have more tools and more toys to play with.
Okay. Now, also, Tanya, what would you say is the most important piece of advice you can give to someone who's thinking about getting an aesthetic procedure done or treatment done, but isn't sure which provider to choose?
Well, take your time. You definitely want to have consultation in person. The biggest thing is that, and that's why it's important to have the consultation in person, because you have to feel comfortable with that practitioner, right? So you have to get that feeling. If you don't feel that level of comfort, and I have had clients come in to my space and maybe they visited somewhere else, maybe somewhere that's a lot more fancy, and they felt very small in that space. They felt they didn't feel seen or really heard. So I make sure that I tell people, you need to make sure, first of all, that they're listening. So you don't want to go somewhere where they're just going to tell you, we're doing this, and they're not taking into account what your comfortability is, what your expectations are, or they're being dismissive, right? So that's huge. That's first and foremost. You want to make sure that you are being heard, and then you need to be comfortable with them. Then you need to make sure that because like here in Texas, it can, and in some other places, it can be a little bit of the wild, wild west. And so you have people, doing injectables that shouldn't really be doing things. So you want to make sure that the person has the credentials for the services that they're providing as well. And yeah, take your time, don't rush. And I always tell them, do not, of course we all have our budget, right? You have a realistic budget that you're working within, but do not let price be the determining factor for who you are deciding to do the service with. because I guarantee you, you're going to get exactly what you pay for. So if that price seems too good to be true, I guarantee you it is. And when you are doing these kinds of services, once you get something in your body, it's in there. Getting it extracted can turn into a lifetime of problems, and you do not want to go down that road. So it's best to take your time on the front end, do your due diligence, maybe wait to get the procedure. If your budget doesn't allow for the best option, maybe you need to wait, right, to get it done. So that's my advice.
Great advice. Great advice. Now, Tanya, I have one last question for you, but before I ask it, I want to point people to your website at aestheticwellnessrn.com. Now,
Yes.
my question is, what does beauty mean to you? No right or wrong answer, but what does beauty mean to you?
Beauty means to me confidence in my own skin, just feeling radiant, feeling good, and it's effortless. That's beauty. When you're confident, you feel good, and you're able to express yourself and just flow. Like it's not something that you should have to drag, push, and pull. It should come easy. And when your body is working synergistically, when you are in balance, it just flows. Like that's just it, period. You have no choice but to show up beautiful.
Yeah, well, a great definition, Tanya. Well, there you have it, Tanya sharing her expertise. Now, Tanya, if people want to learn more, where can they contact you in your practice?
Okay, so absolutely. We are on all your major social platforms. So Instagram, TikTok, and Facebook at Aesthetic Wellness RN and Aesthetic Wellness Med Spa. So either one of those you can find us. And of course, our website is there. We are located in Coppell, Texas, which is conveniently just under 10 minutes from the Dallas-Fort Worth Airport, which is important for those who love to fly in for the BBL. That happens a lot. And yes, and then of course our phone number is listed everywhere. You can Google us, and all the information is on my Google business page as well.
Awesome. Well, Tanya, this was great. Thank you for being on the show and sharing your message.
This was absolutely wonderful. It's great to have met you, and I appreciate the opportunity to be on the platform, Daniel.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.